Well, one of the nice things about reoccurring guests like GBMC is that we get to learn the full breadth of services that they offer the community. And we've got social worker Stephanie Babalut. She is the team coordinator for Greater Baltimore Cleft, Lip, and Palate. Thanks so much for being with us.
Thank you for having me.
So tell me a little bit more, because we know that July
Mhm.
is Cleft and Craniofacial Awareness Month. So it really is a perfect time for us to learn what it is that you do at GBMC. And let's start with the typical age range for your patients and actually what you do with them.
Yeah, so our age range is anywhere from birth all the way through adulthood. We see and treat anybody. And sometimes we also start working with patient families prenatally if they were to learn about a cleft lip or palate during an ultrasound. So we are able to meet with them at that time and provide support and explain what our care will look like from that point. So, and it's a continuum of care. So once we're involved, we stay involved for many years to come.
And when do you start getting involved? I mean, I heard that you could do it even prenatally, but
Mhm.
when patients start to come to you in person, is that right away?
It's as soon as possible when we have a baby. So, like I explained, prenatal patients, if they learn about a cleft during an ultrasound, they can give us a call. We
Okay.
can start working with them right away. Oftentimes, we do start working with babies right after birth, whether we receive a referral from another local hospital or if a baby is born right here at GBMC, our team begins care right at the bedside before the family is discharged. So various members of our team will be there to provide support and answer questions to the parents and do exams and then schedule them for all the follow-up they need.
What types of emotional support do you offer patients when they're going through something like this? Because again, this is something that occurs that is unexpected.
Mhm. Yes, and our team, all of us, everybody that's on the team really values the psychosocial support and emotional health of not only the patient, but the whole family. So we want to know, how are the caregivers doing? How are the siblings doing? How is our patient doing? So we provide appropriate referrals for counseling and therapy whenever needed. We will work directly with the school or any other institution that our patient is receiving services from. And we also try to offer a lot of patient to patient or caregiver to caregiver support whenever that is needed as well. So our goal is to bring as many patients and their families together in person, meeting each other, having fun, sometimes trying new things, which is really fun for our older patients, such as rock climbing, or we recently did a virtual painting event where we could be together trying something new virtually. And we also offer parent to parent or caregiver to caregiver support. And a lot of families find that really helpful when they're getting ready for a surgery or a new treatment to connect with someone else that has been exactly where they are.
Exactly.
So we always offer that. And our goal in all of that is that our families and our patients know they're never alone. This is cleft lip and palate is a very common birth defect, and they're certainly not alone.
Well, I love that you are able to connect these parents and connect these patients as well, so that they do know that they're not alone. If they want to reach out and make an appointment, I think it's just GBMC/Cleft. Is that correct?
That is correct. Yes. And they can call, my number is listed right on the website, and patients, regardless of age, can self refer and call me directly to set up an appointment and start their care.
And I like that you touched on that again. We talked a lot about being babies and being young, but again, this is for anybody at any age. If they have this, that they can
Mhm.
definitely reach out to GBMC and start working with their team. So that is great. Stephanie
Yes.
Bulach, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.
All right. Thank you.